Hello, Clinic Review family. It's Dr. Sharon, and today we're continuing on with dangers and discomforts during pregnancy. Today we're talking about the second trimester, and so I'd stick around and watch this. You could definitely have it on your NCLEX. Let's get started. Hello, Clinic Review family. It's Dr. Sharon with Clinic Reviews. Thank you for being part of our Clinic Review family. You know that this channel is a part of the greater Clinic Review organization. You can go to clinicreviews.com to sign up for one of Mark's phenomenal NCLEX reviews. Y'all, I do not teach on this channel what Mark teaches in his NCLEX review. So this channel is not a substitution for his NCLEX review. This channel is a supplement to that. It's also being offered to you for those of you who cannot afford to do his NCLEX review. That's part of the reason I'm doing this, but I don't want you to think that I'm teaching what he teaches in his NCLEX review. Clinic Reviews also offers monthly small group tutoring bundles as well as a streaming service. Today, we're continuing on with our walk through the Blue Book. The second trimester dangers and discomforts is in the Blue Book. And that's what we're talking about. We already did the first trimester, and I didn't really want to make an hour-long video. I just wasn't in the mood to sit here for that long and do that. So that's why we've broken them up. The next video is going to be third trimester dangers and discomforts. So let's go ahead and get started. You know that when I teach what's in the Blue Book, the Blue Book is facts, right? It's content that you have to know. I don't teach it the way it's taught in the Blue Book. You get the Blue Book, you study the facts. What I'm doing is I'm writing NCLEX questions that go along with the Blue Book so that you can supplement that information and you can learn it and understand how to apply it in NCLEX questions. Client at 22 weeks gestation reports to the nurse that she has been experiencing frequent headaches and occasional dizziness. Which action should the nurse take first? All right, 22 weeks. So second trimester is 13 to 25 weeks approximately. So we've got a patient who's having headaches, and I say to myself, well, headaches is actually an expected discomfort, but I don't expect dizziness. So let's see what my options are. Advise the client to rest and apply cold compress when headaches occur. Well, that addresses the headaches. Instruct the client to monitor her blood pressure and report elevated readings. So I think what they're saying there is they're suspecting preeclampsia. So some of the symptoms of preeclampsia are headaches and dizziness. Those are possible symptoms. So, okay. So that actually addresses both things. Reassure a client that headaches are a common discomfort during the second trimester. That's a true statement, but it only addresses the headaches, not the dizziness. Encourage increased fluid intake to prevent dehydration. Well, there's no reason to think they're dehydrated. So we're going to cross off D. Now, one thing I've learned is that when I'm answering a test question, I want to address all of the issues in the question. So there's headaches and dizziness. A and C only address headaches. And it is true that headaches are common discomfort of pregnancy, but the dizziness is not. And when you combine the headaches with the dizziness, it could possibly be preeclampsia. And to know if it's preeclampsia, you got to check her blood pressure and do your analysis. So I have to pick B because I have to pick an answer that addresses the entire set of problems, not just one of the problems that she's complaining about. During a prenatal visit, a client at 18 weeks gestation expresses concern about dark patches that have appeared on her face. What is the nurse's best response? Okay, 18 weeks, again, that's second trimester. This is known as cloasma and is a normal finding during pregnancy. So that's a true statement. It is dark patches on the face is cloasma, and it is a normal finding during pregnancy. You should reduce your exposure to sunlight to prevent further darkening. I don't know that that was going to help. It could help. So maybe we can put a question mark next to it. We'll schedule you for a dermatology consult to assess the patches. That's not necessary. It's an expected finding. It's a discomfort of pregnancy. This could indicate hormonal imbalance. That's not true. So we're going to cross off C and D. So the question is, what is the best response? So if I can only say one thing, do I want to say, hey, this is normal, you don't need to worry about it because it's not harmful to you? Or do I not want to tell her it's normal, just tell her to reduce her exposure to sunlight? Well, I would rather tell her it's normal because she's worried about it, right? She's worried about it. So I got to tell her it's normal. So A is my best response. Do I want to talk about sun? Maybe. I mean, I don't think that's really a major issue. And I don't even know that she's exposing herself to sunlight. So I'm advising her to do something that I don't even know that she's doing. So A is my best response. At a routine prenatal visit, a client at 20 weeks gestation mentions that she has been craving and eating ice and clay. Which action is the most important for the nurse to take? So eating clay or dirt is called pica. Eating ice is also an indication of anemia. And it would not be unusual for someone to become anemic when they're pregnant because their plasma volume increases significantly, which can dilute their hemoglobin and the hemoglobin can drop. And so eating ice and clay, now I'm not saying it's normal to eat clay, but there's a craving for that. Okay. Document the cravings as a normal part of pregnancy. Well, it's not really normal. It may not be unexpected, but it does indicate a underlying problem. So I don't want to necessarily say it's normal. Suggest substituting unhealthy cravings with nutritious snacks. I don't know that that's addressing the underlying problem. Assess the client for signs of anemia, notify the provider. That sounds like a good idea. Explain that these cravings will subside in the third trimester. Well, probably not if we don't address the underlying problem. So we are going to tell the provider about this. It may not be completely unexpected, but it is more of a complication of pregnancy. So there's symptoms, expected discomforts, and then there's complications that we have to address. So nurses can address symptoms, nurses can address expected findings, but we have to report unexpected findings or complications. So we do have to report this one. During a prenatal visit at 20 weeks gestation, a client expresses concern about not gaining any weight over the past 4 weeks. What is the nurse's best response? Well, in the second and third trimester, they're supposed to gain 1 pound a week, and they have a monthly appointment until week 28. So they should have gained 4 pounds plus or minus 3. So they could have gained anywhere between 1 and 7 pounds. Okay. So anywhere between 1 and 7 pounds. They haven't gained any weight. I am a little concerned about this. So let's see what the answers are. Weight gain can vary, but we should assess your diet and activity level to ensure you're on track. Okay, so what is the nurse's best response? Weight gain can vary, but we should assess your diet and activity level to ensure you're on track. Well, that's true. That is true that weight gain can vary. And we should assess your diet and activity level. It's normal not to gain weight during the second trimester. You'll catch up in the third trimester. That's not true. They should be gaining 1 pound a week. As long as you feel fine, there's no need to worry about your weight gain. That's not true. You should increase your caloric intake by 500 calories per day to promote weight gain. Well, I don't know what she's eating, so I can't say D until I've done A. So I'm going to cross off B and C for sure because those are not true statements. A is a true statement. I am concerned about it, but I'm going to have to see what she's eating and what her activity level is like before I make recommendations. So even though it's not a first question, so sometimes first and best answers are not the same, and sometimes first and best answers are the same. And in this case, A is really the best thing to do, as well as the first thing to do. A client at 20 weeks gestation is concerned about visible stretch marks on her abdomen and thighs. Which response by the nurse is appropriate? So striae are stretch marks. Those are expected. So let's see. Stretch marks are permanent, but they'll fade to a silvery color after delivery. Well, that's true. Applying vitamin E oil daily can prevent new stretch marks from forming. Maybe. This is an abnormal finding. We need to evaluate your skin's elasticity. That's false. You can undergo laser treatments now to reduce their appearance. That's untrue. That's false. So I'm going to cross off C and D. So which is appropriate? To tell her to give her a true statement that stretch marks are permanent, but they'll fade, or to tell her that she can apply vitamin E oil daily. So I've told you this before. I say, don't pick an answer you're unsure about over an answer you are sure about. And I am sure that A is a true statement. So I'm going to pick A because I am sure about that. Now, I want to tell you why I put this question in here. I put this question in here because I want to teach you something. NCLEX will only choose treatments that are evidence-based. There has to be an evidence base for them. And that's why we can kind of be sure in telling you like what are evidence-based interventions, and we teach those and we say these are safe answers on the NCLEX. And giving a true statement is always a pretty safe answer on the NCLEX. A is a true statement. So here's the deal. B is not evidence-based. there's some thought that it could help, but there's no literature, there's no evidence to support it. And NCLEX does not like answers that lack evidence base. That's why NCLEX does not like supplements. They don't like over-the-counter treatments, generally speaking, that aren't evidence-based. So vitamin E oil, that's why you and I we're like, I don't know, maybe that helps, maybe it doesn't, because there's no evidence base. If there was an evidence base, you would have been taught it in school to recommend that. But we don't know that. So we are going to give her the true statement. Now, if she says to me, can I put vitamin E oil on? I would say, sure. That's safe. You can do that. And if she said to me, well, is it going to get rid of my stretch marks? I'd say, no, it's not going to get rid of your stretch marks. Is it going to prevent me from getting new ones? Well, there's some evidence that moisturizing does help, but I don't know that vitamin E is necessarily going to help, but you can try it if you want to. So that's what I'm saying is we can't tell somebody that something is going to prevent something unless we know for sure that it's going to do that. During a prenatal class, a client at 21 weeks gestation asked why she's experiencing heartburn frequently. What is the best explanation by the nurse? Heartburn is a sign of impending labor. You should prepare accordingly. I hope not at 21 weeks. No, that's not true. It is likely due to your diet. You should avoid spicy and fatty foods. It could be. I don't know that they eat spicy and fatty foods. It's good to tell them to avoid those, but I don't want to say heartburn's because of her diet. I don't know what her diet is. This is unusual in the second trimester. You should see a gastroenterologist. That's false. It's very common. It's a common discomfort of pregnancy. Your growing baby is pressing on your stomach, causing acid reflux. Absolutely. That is absolutely true. That's the best explanation. Now, should she avoid spicy and fatty foods? Sure, but I don't know that she's having spicy and fatty foods. Maybe she's a vegetarian and she's like, I don't have anything bad. So why would I recommend B when I don't know what her diet is? But I do know for sure that acid reflux is a common discomfort of pregnancy in the second, third trimesters because it's the baby pressing on the stomach. A client at 19 weeks gestation reports feeling pelvic pressure and occasional sharp pains on one side of the lower abdomen. Okay, pelvic pressure and occasional sharp pains on one side. What should the nurse explain to the client? These are Braxton Hicks contractions are normal at this stage. That's not true. That's not what Braxton Hicks. Braxton Hicks are false labor, and they do tend to happen more regularly. And so it's not just occasional pain on one side. That's not what a Braxton Hicks contraction is. You might be experiencing round ligament pain, which is common. Okay, round ligament pain is a common discomfort of pregnancy in the second trimester, and this is how they feel. They feel like pressure and occasional sharp pain on the lower abdomen. This could indicate preterm labor. You need to be evaluated immediately. No, preterm labor is regular contractions. Pelvic pressure is a sign of urinary tract infection. We'll need a urine sample. Pelvic pressure, is that an indication? Not usually. I mean, the frequency is an indication of urinary tract infection. Burning with urination is an indication of urinary tract infection, but pelvic pressure alone is not. And certainly occasional sharp pains on one side of the lower abdomen is not consistent with the UTI. So the only answer that's consistent with the symptoms that she's complaining of is round ligament pain. Okay, so that's the correct answer. So I'm teaching you what round ligament pain is. That's what I'm teaching you. And I'm teaching you it's an expected discomfort of pregnancy in the second trimester. A client at 20 weeks gestation comes to the prenatal clinic for a routine checkup, which findings should be reported to the healthcare provider. So we're looking for the unexpected finding, increased pigmentation of the areola and vulva. That's expected. That happens definitely during pregnancy, and it starts to happen in the second trimester. Occasional headaches relieved by rest. That's common. Again, I've told you this, it's common all the way through pregnancy. With it actually tends to get less common as the pregnancy goes along, but it's common with all the hormonal fluctuations. Sudden swelling of the face and hands. So I don't like the word sudden. We had a question in the previous video where I said they had swelling in their ankles at the end of the day. And I said that's expected because of increased plasma volume. But sudden swelling of the face and hands, that's not at all the same thing. That's an indication of preeclampsia. So I don't like that. Feeling fetal movements. Fetal movement starts in the second trimester. So I'm going with, I have to report the unexpected finding, which is sudden swelling of the hands and face. At a prenatal appointment, a client at 23 weeks gestation is concerned about visible veins on her legs becoming more pronounced, which is a result of increased plasma volume. What advice should the nurse provide? So we have varicose veins. That's what we have. And what is the treatment for varicose veins? Y'all, it doesn't matter if they're pregnant or not. The standard treatment for varicose veins is pressure, okay, and elevation of the feet. That's the standard treatment for varicose veins, whether it's pregnancy or some other reason, fluid volume overload, which is pregnancy. Wear compression stockings and avoid standing. Absolutely. Classic teaching for varicose veins. This is temporary. The veins will disappear after delivery. Sometimes they do, sometimes they don't. I would not tell them it's temporary because it might not be. Increase your vitamin K intake to strengthen your blood vessels. That doesn't do anything to strengthen blood vessels. Limit your physical activity to prevent further vein enlargement. Actually, walking activity, standing still is bad because you have venous pooling, but when you're walking, you actually have an increased muscle pump and it actually pushes the blood back to your heart. So activity is not a bad thing, but you do want to avoid standing for long periods of time, and we do recommend compression stockings. A client at 18 weeks gestation tells the nurse she feels pelvic pressure and notices varicose veins forming. Okay, pelvic pressure and varicose veins forming. So those don't seem that concerning to me. Which accompanying symptoms should be reported to the healthcare provider? So I don't think it's saying these are all related. I think it's saying, look, they come in at 18 weeks. They're in for their 18-week appointment, which isn't a typical appointment, but they're there for their 18-week, whatever. And they say pelvic pressure. And I go, that's okay. That's expected. Varicose veins, that's expected. Wear compression stockings. Elevate your legs when you're sitting. Don't stand for long periods of time. And then they say, what else? What then should be reported? So leg cramps at night, shortness of breath while resting, palmar erythema, or oily skin and acne. So oily skin and acne is an expected discomfort, so to speak, of pregnancy. Palmar erythema, I don't know why, y'all. Palmar erythema is also a symptom of liver disease, but and it may be the enlarged liver. It may be an enlarged liver issue, which does get bigger with increased volume in pregnancy. So maybe that's why they get palmar erythema, but palmar erythema is expected. Leg cramps at night. Leg cramps at night. That's not, I've never, ever known of leg cramps at night being a emergency symptom. I've just never heard of it before. Whereas shortness of breath while resting, that doesn't sound good. Shortness of breath with activity. She's a second trimester, third trimester. They often get short of breath with activity, but while resting, I'm concerned about that. I don't like that. So that's the one I'm going to report. Even though I don't necessarily know that leg cramps at night is okay, I've never heard of it being a problem. And I'm not going to decide now that it's a problem when I know shortness of breath while resting is a problem. Okay, I know that. I'm not going to pick the answer I'm unsure about over the answer I am sure about. During a routine visit, a client at 25 weeks gestation reports feeling occasional heart palpitations. What is the nurse's best response? You should reduce your caffeine intake to alleviate palpitations. So this is like the other questions. I'm telling them what to do before I know more. I'm telling them what to do when I don't know that they're having spicy foods. I'm telling them to reduce their caffeine when I don't know what kind of caffeine intake they're having. I'm telling them to increase their caloric intake when I don't know what their caloric intake is. You can't make that recommendation unless you know that they're ingesting caffeine. We'll need to schedule an electrocardiogram to assess your heart function. This could be a sign of anemia. Let's check your hemoglobin levels. Heart palpitations are common due to increased blood volume during pregnancy. That's actually a true statement. It is an expected discomfort during pregnancy. We shouldn't need to do an ECG. It really doesn't have anything to do with anemia. So it is an expected discomfort during pregnancy. Second and third trimester because they've increased vascular volume. A client at 26 weeks gestation has gained a total of 10 pounds since her last visit 4 weeks ago. Which assessment is most important for the nurse to perform next? All right, so she should be gaining 1 pound a week. So if her last appointment was 4 weeks ago, because up until 28 weeks, it's a monthly appointment. So in 4 weeks, she should have gained 4 pounds plus or minus 3. So she could have gained anywhere between 1 and 7 pounds. So she really is outside the norm. She's gained more weight than I would expect her to gain. So what do I want to do next? Measure the client's fundal height to assess fetal growth. Maybe check the client's blood pressure and test urine for protein. Well, that's testing for preeclampsia. And weight gain, water retention, weight gain is a sign of preeclampsia. So that seems like a good idea. Review the client's 24-hour dietary recall for excessive caloric intake. That sounds like a good idea. Assess the client's activity level and recommend increased exercise. Well, I don't want to recommend increased exercise until I know what's going on. So I'm going to cross off D. Fundal height, fetal growth, that doesn't seem like the first thing I'm going to think of. Okay, that's not what I'm thinking of. Maybe eventually, if I rule everything out, I'll do that. So I'm going to cross off A and D. So would I rather assess her diet, or would I rather check to see if she has preeclampsia? Is there any chance she could have preeclampsia with a 10-pound weight gain in 4 weeks? Y'all, there is a chance. So if I want to show the National Council of State Boards of Nursing that I understand that I have to assess for the highest risk problems first, then I want to choose B. Because if her blood pressure is fine and there's no urine protein in her urine, then I can go on and go, okay, let's talk about your diet. Let's talk about your activity level. Because C and D kind of go together. Like I would want to do activity level and diet. So how can I say one? I can't say C or D is more important than the other one. So my biggest risk is preeclampsia. So I've got to do B first. Okay, that's second trimester. I hope you learned some things. I hope you learned some vocabulary particularly. And the next video is going to be dangers and discomforts of pregnancy, third trimester. I'll try to get that out as soon as I can. I hope you have a great rest of your day. Thanks for being a part of our family.